Dr. Marie-Pierre St-Onge, Chair of the Statement on Multidimensional Sleep Health, Definitions and Implications for Cardiometabolic Health. And I'm here with my Vice Chair, Dr. Michael Grandner, to talk to you about the reason behind developing this statement. Both of us were involved in a prior statement that was published about 10 years ago on sleep duration, sleep quality, and cardiometabolic risk factors that showed how obtaining insufficient sleep was associated with an increased risk of obesity, type 2 diabetes, and cardiovascular disease. And Dr. Grandner was involved in a presidential advisory that included sleep duration as an eighth metric to Life Simple 7, making it essentially Life Essential 8.
Yeah.
So tell me about, how that came about and why sleep duration was the chosen metric to include in Life's Essential 8.
After the paper that we had worked on previously, really bringing the concept of sleep health to AHA and the AHA audience, showing how for decades we have data linking sleep health to all kinds of cardiometabolic outcomes. When it came time to discuss metrics for Life's Essential 8, one of the issues is that we were somewhat limited by data in other dimensions of sleep health. Now, sleep researchers, we know that sleep encompasses multiple dimensions, where sleep duration just being one, but that's where the best data were. And so that's where, that's why it was included in Life's Essential 8 that way. But with this new paper, we're going to be able to broaden that story a little bit.
Right, because multidimensional sleep health really goes beyond just sleep duration to include concepts such as timing, regularity, quality.
Also in terms of how it affects your daytime functioning, also in terms of aspects of sleep physiology. There's and to some degree also how it relates to other rhythms. So sleep has multiple dimensions. It's not just how much you get, it's also when and how much and the quality of it.
Right. So with this scientific statement, we're really asking the scientific community, really, and the medical community to start asking questions about that from their patients and from their research participants related to these other dimensions of sleep, so that we can gather evidence to enhance our knowledge about sleep in its totality and be able to make future recommendations related to multidimensional sleep health and cardiometabolic health.
Yeah, this came out of the new AHA Sleep Committee, which I'm the chair of, and you're the vice chair. But you're rising as the new chair, and I'll be past chair. Yeah, and so this is the first statement that's coming out of that committee, because as a sleep community, this is something we've known for a long time, and over the past few years, even since the publication of Life's Essential 8, there's been a whole bunch of new evidence that has been linking these other dimensions of sleep health to important cardiometabolic outcomes. And we really felt that it was time to highlight these findings, bring them all together, and help create this call to action to the AHA community to not only incorporate other dimensions of sleep health in their understanding of how sleep is relating to heart health, but also think of it from a scientific perspective and ask new scientific questions about other dimensions of sleep as well.
Yeah, and this was a really nice group effort from
it was great.
Our committee and other members outside of the committee. We'd like to thank Drs. Brooke Agarwal, Julio Fernandez Mendoza, Christopher Klein, Kristen Knudsen, Dana Johnson, and Nancy Redeker for participating in this scientific statement. And obviously none of this would have been possible without the help of Dr. Mu Wang, who helped us get our paper together.
Yeah, so definitely want to encourage everybody to check this paper out, read it, and if you have any questions, it'll be great to start incorporating some of these concepts into your work.